Very cool. Action.
Today I'm going to persuade new mothers of how important it is for breastfeeding. Breastfeeding is important to babies and mothers. Because it is so important, President Obama signed a law in 2010 that requires employers to provide a reasonable break time for mothers to express breast milk for a nursing child up to 1 year after the child's birth. Each time such employee needs to express milk, she has the right to do that. The employer is also required to provide a place other than a bathroom for the employee to express breast milk. An employer with fewer than 50 employees is not subject to these requirements. I breastfed my son, and we very rarely went to the doctor with illnesses, and he never had an ear infection. You need to better understand why breastfeeding is so important before you can make the decision to choose breastfeeding or bottle feeding. So let's take a look at some of the reasons that it's so important. The first reason, according to breastfeeding.com, is the health. Breast milk can prevent some food allergies for babies. It can prevent ear infections. Breastfed babies are less likely to develop heart disease. It also might reduce the risk of developing childhood diabetes. The second reason is that the American Academy of Pediatrics supports it. Third reason is you can save up to $1,000 per year depending on how much your baby eats. You and your child will have a special bond that nobody else will. According to womenshealth.gov, there are 6 tips for making breastfeeding work. You need to learn your baby's hunger signs. They become more alert and active when they're hungry. They might put their hands or fists in their mouths, make sucking motions with their mouth, turn their head looking for a breast. Crying may be a late sign of hunger, and it might be harder for the baby to latch on. The second tip is to follow your baby's lead. Make sure you're both comfortable. Your baby will let go of the breast when he or she is complete. Offer the other breast if he or she seems like they're still hungry. The third tip is to keep your baby close to you. Remember that your baby is not used to the new world and needs to be held very close. Being skin on skin helps the babies cry less and stabilizes the baby's heart rate and breathing rates. You should avoid nipple confusion. Avoid using pacifiers, bottles, and supplements of infant formula in the first few weeks of the baby's life unless there's a medical reason to do so. If supplementation is needed, you should try to give express breast milk first, and this will help you make more milk and keep your baby from getting confused while learning to breastfeed. Sleep safely and close by. Have your baby sleep in a crib or a bassinet in your room so that you can breastfeed easily at night. And also, sharing your room with a parent is linked to a lower risk of sudden infant death syndrome. You should know when and how to wake your baby. In the early weeks after birth, you should wake your baby to feed if 4 hours have passed and your baby hasn't eaten. Changing your baby's diaper, placing your baby skin to skin, or massaging your baby's back, abdomen, and legs are ways to wake your baby. Your pregnancy week-by-week book gives a few tips on learning how to breastfeed. You may want to learn how to breastfeed while you're still in the hospital, and you should ask a nurse any questions that you have. Breastfeeding requires a healthy nutrition plan for you. You will need at least an extra 500 calories per day. Some doctors recommend continuing prenatal vitamins after pregnancy while you're breastfeeding. You should be careful what you eat and drink because the things you eat and drink pass through your breast milk. Certain foods may not sit well with your baby. Spicy foods can upset the baby's stomach. Caffeine can remain in the baby's bloodstream for up to 96 hours, and any alcohol can pass through your breast milk. Alright, successful breastfeeding. Here are some tips on positions to hold your baby for breastfeeding. First, we have the cradle hold. It's an easy and common hold that is comfortable for mothers and babies. Hold your baby with his or her head on your forearm and his or her whole body facing yours. We have the cross cradle or the transitional hold. It's useful for premature babies with a weak suck, because it gives extra head support and babies may stay latched. Hold your baby along the opposite arm from the breast that you are using. Support your baby's head with the palm of your hand and at the base of his or her neck. clutch, or commonly known as the football hold. Useful for mothers who had a C-section and mothers with large breasts, flat or inverted nipples, or a strong let-down reflex. It also is helpful for babies who prefer to be more upright. This hold allows you to better see and control your baby's head and to keep the baby away from the C-section incision. Hold your baby at the side, lying on his or her back, with his or her head at the level of your nipple. Support your baby's head with the palm of your hand at the base of your head. The baby is placed mostly underneath your arm. And then we have the last one is the side lying position. This one is helpful for C-section mothers or for mothers to get any additional rest while breastfeeding. Lie on your side with your baby facing you. Pull your baby close to your body. It is possible for working mothers to breastfeed. The U.S. Department of Health and Human Services Office of Women's Health Magazine, your guide to breastfeeding, states that you should talk to your supervisor about breastfeeding. Work with your supervisor to find a private place for you to express your milk, an office with a door, a conference room, or a rarely used little closet or storage area. You should express and store your milk during the times that you would normally feed your baby. Talk to your supervisor about the best place to store your breast milk. Be sure that you label your milk container with your name and the date that you express the milk. If you are uncomfortable with storing your breast milk in the employee refrigerator, you could buy a refrigerator to keep at your desk or bring a small cooler with you every day. In this speech, I have expressed my opinion that breastfeeding is better than bottle feeding. And since I know how important it is, I am expecting my second child in January